study of drugs. You have to think about the drugs, how much dose you have to give, how much amount, how much concentration, how much solubility, how much concentration gradient, how much permeability this drug has. Okay, in all the drugs, which drug affects which part, which drug has which effect, the whole thing about the drugs we are going to discuss in this section. First of all, pharmacokinetics or pharmacodynamics. These are two different things. Pharmacokinetics means drugs, pharm means drugs, okay, and kinetics means action. So pharmacokinetics is the branch which deals with that of the action of drugs in our human body. How the drug works in our body, it is being taught in pharmacokinetics. If you know the pharmacokinetics, then you can get to know each and every drug. So it's just all about cramming afterwards. The main mechanism lies under this topic. So you have to be very clear about the concepts in the pharmacokinetics. Okay. First of all, pharmacokinetics leads to three basic things. Four basic things. What is drug administration? In this, we are going to talk about how the drug is taken, how we can take the drug, and how it's going to work further. In drug administration, there is how the drug goes into our body. It's just not the air that you just blow a whistle and you get cured. Drug is the medicine which we take. So how many ways you think that we can get the drug? Oral? Yes, oral. Intravenous? Intravenous.
Intramuscular.
Intramuscular.
Subcutaneous.
Subcutaneous.
Transdermal.
Transdermal.
Subdermally. Penicillin.
It's in the same.
No, it's not good. It's not subcutaneous. Then through rectal. Then
patch
inhaler.
Inhaler.
Yes.
And the last one.
Dropper.
Even the dropper. And we can say tropically. Okay. These are certain conditions like orally, intramuscular, intravenous. Then we can get through the rectal. Then we get the tropical. Then we get the patches, the inhalers. These are whole stuffs that will go inside our body. They will go inside our body and they will act. So this is the drug administration. In this we can say there is IV, there is and IM, there it can be oral, but the most effective way is most long lasting. So it depends upon the half-lives. So we can say that there are different procedures, there are different half-lives, there are different effects. On that we will just go through all these things. After that we administered the drug. What do you think that next must be? It must be the absorption. Okay? There is the absorption of the drug. It goes into our blood, it goes into our systemic circulation, it goes into our muscle, it goes into our veins, it goes into our rectal region. It has to be absorbed. If the drug wants to be affected, if you want the drug to be affected, then it must have to be absorbed in either way, this way or that way. Okay? So absorption, in absorption we will see what happens in the absorption sections, how the drug is absorbed, how it is taken by our body. This is under this. Now after absorption, what is the other condition? There is other condition. We can say there is the distribution. If there is no distribution, then how your drug will get to know that which part is affected, which part I have to go, and in which part I have to work for. So this is distribution. It's so simple. It doesn't need any scientific rocket science to be understood. After that, we can say that after the distribution, there is the last thing which everyone knows and you must have to know if you don't know. There is elimination. The drug has to be eliminated. It must not remain in our body forever.
What about drugs action?
This is the action. Like absorption, distribution, distributed. If it is distributed, then it is affected. Okay? So there is elimination. From here to here, there is distribution. From distribution to elimination, there is the action, the work. But we divide the pharmacokinetics into 4 things. Okay? This is how it works. In this, we can say there is biotransformation in distribution, there is biotransformation 1 phase 2. By this, we can say there is degradation of the drug. This is not like we have to write each and everything on the board. This is the 4 basic things. Whenever someone asks you what is the pharmacokinetics, even the kid knows this, that there is administration, absorption, distribution and elimination. So this is the basic concept which I want to put in your minds. But still, the further detail, we are going through it. For the pharmacokinetics, you must have to know about the 2 factors. Permeability, number 1. And ionization. For the drug to work, you must know how much your membranes are permeable. How much the solubility is there, how much the concentration is there, how much the effect is there. And in the ionization means the charged particles. How much the drug is ionized, it means how much the drug is charged. Okay? There are weak bases, there are weak acids. In the book, you don't have to follow the book. You just have to get the concept. It's just not the rocket science that you are just cramming the words. It's not like that. You just have to think how these drugs work and move ahead. Okay, in permeability section, we are going to think, there are 2 things, permeability and ionization. Think about the graphs, solve the MCQs, and our chapter is complete. So, permeability. In permeability, first thing which comes in our mind is solubility. Okay, solubility means that how much the drug is soluble in our body. Like it is water soluble or it is lipid soluble. With lipid soluble, they can cross the membranes. Let me make it for you that this is the, what is this? This is the membrane. A typical membrane, but this is a lipid barrier. It is a lipid barrier, so if the drug is a lipid one, it is lipid soluble, then it can cross easily. But what about if it is a water soluble?
It cannot pass.
It cannot pass through this so this membrane, this plasma lemma. So what about those drugs which are water soluble? There is a question. We will go through that, how the water soluble drugs pass through the set specific area. So what if it depends upon the permeability, pharmacokinetics. So the drug depends upon the permeability and ionization. In permeability, we say there is a solubility. What if it is lipid soluble? What if it is water soluble? If it is lipid soluble, it can cross through. But if it is water soluble, it cannot cross through. Okay. Then there is the concentration gradient. So concentration gradient we have already discussed in our physiology, that there is a facilitated diffusion, there is active diffusion, there is passive diffusion and the stuff like that. So in that we can say that it is active or it is passive or it is facilitated. Oh, there is a crap about my pronunciation. I don't know what has happened to it, but like it can go from higher concentration to lower concentration, this is passive. It can go from lower concentration to higher concentration, it is active. And if it is facilitated by any kind of channel, by any kind of protein, by any substance, then it is called as facilitated. Okay, this is facilitated gradient. Okay, diffusion. These things we have already discussed. Don't need to cram about it. And the third thing which we are going to see in the permeability is what there is the surface area and vascularity. Okay. If the surface area is large, it can be absorbed large. If the surface area is low, then it can be absorbed less. And what about the vascularity? Vascularity means in the blood, in the vessel, then how much it is absorbed. If the surface area is larger and greater is the vascularity, then the drugs is absorbed greater. Okay, so permeability is just about the solubility of the drug, the concentration of the drug, the surface area of the drug, and these are the three conditions of permeability. Now, what is ionization? Ionization is just the charging of the drug. Ionization typically means charge. Charging. Charging what? Not the charging of the cell phones or the batteries. It's just about the getting the proper charge. Like if it is the positive charge or if it is the negative charge. Okay? Weak drugs, we are like weak acids and weak bases have low charges. Then there is a condition called as ionization and non-ionization. If it is charged, then we can say it's ionized. If it is not charged, we can say this is non-ionized. So charged particles can easily cross through the membranes. Charged particles cannot easily, charged particles cannot easily cross the membranes. But non-ionized, like if there is no charge, non-ionized particles can easily cross through the membranes. You get my point? So
charged particles cannot.
Charged particles cannot cross the plasma membrane, but uncharged particles can easily cross. So how it happens? What are the weak bases? What are the weak acids? We have got the scale of 14. Okay, from 7, 14, and O. If it is in this side,
Acidic.
it's acidic. If it's on the other side, it's basic. So simple it is. It's the basic pharmacology. You don't need to have the rocket science. Just acidic and basic. So if it is in this part, we can also say that it's the weak acid. And if it is in this part, we can say it's the weak base. So simple. Now, we can say that what is the clearance of kidney? If it is the drug is weak acid or the weak base. So how it happens over there? Some of the weak acids are like we can say that there is aspirin, penicillin, cephalosporin. You have to write. There is aspirin, penicillin, cephalosporin. Then is lube and thiazide diuretics. These are the weak acids. Then there are the weak bases like morphine, there's localized anesthetics, there is amphetamine. So these are the things which we can say that these are the weak bases. Okay. Now what we are going to say that what does these weak bases and weak acids mean? For example, let me make a graph for you. pK minus pKa. These are the ranges which I am making for you. You don't have in the MCQ portion, it will help you a lot. This is the percentage of the weak acid, percentage of non-ionized weak acid. Okay, if it's -3, -2, -1, O, +1, +2, +3, what will be the percentages of that non-ionization? Non-ionization, what's their charges? Okay, if it is the weak acid, for example, it's in the basic region. Okay, and how about if it is non-ionized? If the drug is not charged, then it would be 99.9% effective.
Again?
If
Whole chart.
the whole chart?
Yeah.
Okay, let me tell you. Forget about everything. Just listen to my words. This is the acidic condition. This is the basic condition. You get it?
Yeah.
Before 7, it's acidic. After 7, it's basic. It's the, like, everyone knows. Now we have to think about the pH and pKa. Normal pH is 7. You know. pH and pKa. The difference, I've written this in this table. This way, horizontally. -3 ranges. These are the ranges where the drug lies. Okay? It will tell you about the pH of the certain condition. And here we have got the weak acid and the percentage of non-ionization of weak acid. Like we have taken a weak acid. For example, aspirin. We have taken an aspirin. What will be its charge under these conditions, under these circumstances? If our body has the pH minus pKh, it's the difference between the pH and pKh. Like in our blood, the pH is 7. But we have also need to consider the pKa. These are two different things. Then we can subtract these two things. When we get the product, we will say this is the body's normal equilibrium state. So the difference is this environmental condition in our body. You get my point? If you are not getting, stop me here. Okay. We have got a body. This man is sick. Okay. If it is sick, we can say he has to take the drug. He has to take the drug, but its pH, normal pH is 7. But now its pH is 5. Okay. Due to, for example, let me give you an example of respiratory alkalosis. You know, respiratory alkalosis. Okay, remove this alkalosis, acidosis. If the body is acidotic, already acidotic, means that its pH is decreased, like it becomes 5. It becomes 5, but its pKa, according to the plasma concentration. This is the whole body's concentration. This is according to the plasma concentration. It's, for example, let me take that, this is 2. So the difference will give us the pH or the equilibrium state. It's 7 minus 2 is equals to 5. So it's at this condition, at respiratory acidosis, due to this disease, it has the pH of pKa of 2. We have to get to both differences. We don't have to consider one thing. We have to consider both things. Then we can get to know that its pH or its body is acidotic. Its body is now acidotic. He has to be given some kind of alkalotic drug, basic drug, so that we can remove this kind of respiratory alkalosis, acidosis actually. You're getting my point? So what's confusing? What's confusing you? Don't see this point. Just tell me about this.
How you get the pH and how from here you get the pK.
Okay. This
Give
is
the basic concept of pH and pK.
Okay, pH is the measurement. It's just a unit. Like for example, normal standard pH is of our body is 7. When our body gets acidotic, that we didn't take proper meals, we took alcohol, we took like too much spicy food, it becomes acidotic. Our stomach gets acidotic. Okay.
So it will be less than 7.
It would be less than 7. Okay, this is, I'm just trying to give you the concept. It's always less than, because it's the our body, our food has to be digested way, so it has to be acidotic. It's the normal physiology of the stomach that it has to be acidotic. But for example, it's even less than that of normal condition. Our epithelium gets ruptured, you know, Barrett esophagus, and acidosis. It means that its body has become acidotic. He has been taking some kind of meal, or due to the enzymes or due to the pathological condition, it has got the acidosis in the body. Now, what would be its pH? Its pH would be less than normal. Its pH would be less than normal. For example, there is the normal pH is 7. It would be less than 7. For example, it becomes 5 or something. Okay. Now, what is the pKa? You get the concept of pH. It's the hydrogen concentration.
Which is less than 7.
Which is less than 7. Here is the condition. Now, how pH varies? It's like the mitochondria. It's in the ETC, electron transport chain. It generates the hydrogens. It generates the protons. It generates the protons. It means that if there is increased concentration of hydrogen ion, then the pH becomes acidotic. Okay. And after that, in the blood, the hydrogen concentration is 7. It's like measurable, yeah, the standard value which the doctors or which the biochemists gave them. It could be 7.1 to 7.4. Any, for generalized we can say 7. It's hydrogen concentration. You get the concept of pH. Still confused? You can ask me. Yes. Okay. Now second thing, what is the pKa? pKa and pKb. There is the whole, there in enzymatic kinetics. I will teach you if I get the time for the biochemistry. pKa means acidic dissolution in particular the dissolvement of hydrogen, the dissolvement of the acid into that particular substance. We call that the pKa. For example, that this is the blood. How much hydrogen ions can be concentrated in this blood? We can say this is the pKa of that of the blood. Okay? The solubility, the dissolution of that of blood is pKa.
Like how much
hydrogen ions are dissolved in
blood?
Not absorbed. Because in blood, the proteins can be absorbed, this can be absorbed, the other things, but the electrons or the charged particles cannot be absorbed. These are dissolved. Okay, so this we can say this is the pKa. So what would be the pH of this particular man? It depends upon its condition. Probably it's 5. And what do you think? What would be its pKa?
What about the normal pKa?
It varies. It cannot be the same forever. It could be, for example, 3. It could be 2. It could be 1. Okay, this is the normal range. But exceeding this or decreasing this, it affects. I will give you examples how this is going to happen. If you are not getting the concept of pH or the pKa, you have to stop me here right now. This is the dissociation. Oh, pronunciation. This is the dissociation of the hydrogen ions. This is the hydrogen concentration. They are two different things.
Dissociation means the solubility.
Exactly. We can say how much hydrogen ions can be solved. Not getting confused?
Like hydrogen ion concentration and hydrogen ion dissolution.
Okay, hydrogen ion
Like
concentration.
if I take a sample of blood, then how can I differentiate that this is the pH of the blood and this is the pK of the blood?
Okay, this is the blood in which we can say normal hydrogen ions are present. Okay, this is the pH. For example, 7.2. You get it? We got the sample, we got it put in the test tube, and we said that okay, this is what the pH of blood, which normally it is. Now what happens? Due to some extent, we put some other hydrogen ions inside it. There is accumulation of hydrogen ions already inside the blood. This is the concentration. But we put other hydrogen ions that dissolve in that. The power, the ability to dissolve in it, we can say this is the pKa of the blood. That how much, okay, for example, forget about the blood. We've got one box this, one box this, one bucket this, one bucket this. In it, we have put fluid and some kind of like ducts. There are 10 ducts in there. There are 10 ducts, and what happens is, this is the concentration. The ducts makes a community, they live together, they stay together. This is the normal environment, this is the normal condition, this is, we say, this is the pH of the bucket. But what happens if we took this bucket and there are 2 or 3 ducts more? We take that and put in this bucket, the bucket A. So we are putting the hydrogen ions. So they don't deny that we don't want to take that duct anymore. They will accept that thing. This is the dissolution, warm welcoming of that. We can say this is the pKa. How much ability that fluid has that it can accumulate more. If it cannot accumulate more ducts over there, we can say its pH is not good. Its pKa is low.
Like if it can accept 4 ducts, then we can say pKa of that bucket is 4.
For the explanation purposes, we can say. But never tell anyone like this. So you get it from here, we can say this is the concentration, this is the pH of the blood, and this is the pKa, that how much it can dissolve it. But for the normal range, for the normal calculation, we have to take the difference of it. So that we can get the generalized equation or the generalized small amount quantity. Okay? Did you get it?
Yes.
Still confused? Why you look so confused? If you have any query, you can ask. No, it's not okay. Okay, so for the respiratory, for example, this man has got the respiratory acidosis. It has a pH of 5 and it may have the pH of pKa of 1. Okay. Now, how can we manage this patient? We can give alkalosis, alkalotic drugs, which are weak acids. We can give weak acid or the alkalotic drugs, which are what? Aspirin, cephalosporin, penicillin, loop and thiazide diuretics depending upon the condition that this person doesn't have another disease. Don't give, okay, respiratory alkalosis, just treat him without knowing the history. I'm just trying to put in your mind that acidosis can be treated by alkalotic drug. And if it is a respiratory alkalosis, it has been treated by acidotic drugs.
Okay.
This is the simple condition which I want to put in your minds. Now what happens? Weak acid we will give to this person. Respiratory acidosis. Weak acid means strong base. Okay? So we have to give this person the strong base. This is percentage of non-ionized form. Non-ionized form is the best form of the drug.
Uncharged.
Uncharged. Okay? So at this specific condition, we will say that if the pKa and the pH of that drug is -3,
Means acidotic.
it means if it is acidotic, if we give weak acid of the of percentage of non-ionized, like uncharged, forget about it. It's all, the whole table is about the non-ionized best form of drug. Weak acid means basic drug. We will give this patient the basic drug and it will work 99.9% over there.
Because he got acidosis.
Acidosis.
Okay.
Okay. Then what happens if it is pH is -2? Then what happens? It will work 99%. If its pH is difference between the pH and the pKh, then we can say it can work 90%. Then if it is at the zero pH, then it's 50% acidotic non-ionized form, 50% basic non-ionized form. It's at the borderline.
So we give both acidosis.
No, this is the already normal condition.
Okay.
Like for example, we get to know that 7 - 7, 0, or 5 - 5, 0.
Okay.
So if it happens, it feels like that the drug is 50% ionized and 50% non-ionized.
Okay.
After that, what happens? In this condition, we can say 10. In this condition, we can say it's 1, and in this condition, we can say this is 0.1. This is the this is for the purpose of the MCQ. You get it? Or still confused?
Yeah.
And if it is the weak base, percentage of non-ionized, it would be just opposite to that. It will be 0.1, 1, 10, 50, 90, 99, 99.9. You get it? Why? Because when it's +3, the difference between +3, weak base, it means that we have to give strong acid.
So mean it will be ionized.
It will be ionized. At 0, it will be 50% ionized, 50% non-ionized. But here it is still non-ionized. The drug must always be non-ionized. There are some drugs which are ionized, but non-ionized drugs are the best ones.
Because they can easily get absorbed.
Yeah, for certain diseases. It's like for the brain, we don't have to treat the brain, but we give the non-ionized drug. It can cross the blood-brain barrier. It can cross the like glomerulus. It can cross the other barriers. So it will affect the other organs as well, which we don't need.
So best drug work in acidic environment.
Exactly. Okay. It's like if it is acidotic condition, or you are giving the same acidotic drugs, like you are giving morphine, weak base but strong acidic. So it's already body is acidotic. If you are giving it, you may tell the patient. For the acidotic condition, you have to remove the acidosis. You don't have to give the same more acidotic condition to the body. Okay?
Neutralizing that acidic effect.
Yeah, you have to neutralize that acidic effect. And for now listen to the conditions. how this happens, like in the acidic conditions. Increasing the, we have to increase the basic point. Alkaline effects. Increase the urine concentration about base. This is what I'm saying, that this, if there is an acidic condition, we can say respiratory alkalosis. We have to increase the alkaline effects. We have to give the strong bases to neutralize the effect. For example, in which we can say that NaHCO or acetyl, I can write it here. NaHCO, sodium bicarbonate. So it's a strong base. We can give this to, okay, alkalinization of the urine, in which we can say that aspirin misuse or overuse or overdose. Aspirin is
weak acid.
Aspirin is weak acid.
Strong base.
So strong base. So what we do is that we can give here aspirin. No, you have to wait. यहाँ वीडियो कट करो. पैंडो इंसान गलत करा दिया तुमने.